We are live.
Once we go live, we can start our session also.
Yes, we are live.
You are live now? Okay.
Yes.
So, shall we start?
Yes, I think, Sujitji, I think we will start.
Sure.
Recording also, I think recording also is on, no?
Punaji,
Yes,
recording is started?
Yes.
Okay, sure. Yes. So a warm welcome to all of you are participating in this session. This is indeed a contemporary session from prevention to detection and cure AI, IoT, and EI devices for future healthcare, which is going to be the game changer, especially for a country like ours. And we have eminent speakers who are going to share their views on this platform. My special welcome to all of those who are joining from YouTube link. So a warm welcome to all of you. Before I start, just a few administrative suggestions. Please keep all of you who are especially on the Zoom meet, please keep yourself on mute. Video is optional. You can switch it on or you can keep it off. You're absolutely optional. However, please keep on mute, except when you are speaking. We request all our participants to keep questions part towards the end. Towards the end, we are having question answer session with all our speakers and others. So please, question will you can unmute that time and ask questions. Questions for the YouTube viewers, they can post their question in the comment box, and we will be collecting those questions and asking to our speakers. Even from all participants who are participating from Zoom, they can ask question on the text box anytime they wish, and we will be compiling questions and we'll be sharing with our speakers. So with this, let me formally start our session. Just before I start, a quick background of our event. Anant Kumar Pratishthan, which was set up in 2019 to carry forward nation building activities and projects that were close to Sri Anant Kumarji's heart. He's working on the area of leadership development, research in public policy, green lifestyle, and proactive healthcare. As part of the leadership development initiative, Anant Kumar Pratishthan had been organizing Nation First Dialogue series. This is the 14th of our series. In due course, we will share brief about our other series also. This series is on the topic is from prevention to detection and cure, AI, IoT, and eDevices in the future healthcare. Session topic will cover how are the AI, IoT, smart device transforming healthcare in India and globally? What role this technology plays for in the care, in the detection, in the diagnosis, and the treatment? How is that it will reaching out to the common man of at the affordable price, and most important thing at the time when need is there. So these are the topics our speakers are going to cover in this session. Now, before we invite our speakers, I would like to invite Dr. Tejaswini Anant Kumarji to share some of the on the AKP and how is that their whole objective of this. So Srimati Tejaswini ji doesn't need any introduction. Most of us, we know her very well. Before I'll request all of us to congratulate her for the celebrating 500th Green Sunday last Sunday. Last Sunday, she was at Ayodhya and celebrated 500th Green Sunday, uninterrupted, on every Sunday. Green Sunday for last 500, so means almost 10 years. 10 years she has been doing this. So we can see that how it is like social services close to her heart. She started this Adama Chetana, which is feeding more than 2.5 million meals per day. That is the amazing achievement she has. See, detail from the environment perspective, just one example I'll share. Her initiative is Plate Bank. Plate Bank, and she's giving plate bank so that we can save plastic plates. And one estimate, recently someone estimated that calculation, and each plate is saving one tree. So from plate bank, if there is one plate, and so it is saving of one tree. So such a wonderful initiatives is Madam, hats off to you. By education, she is an engineer. She has worked with on our LCA with Dr. APJ Abdul Kalam, and right now she is also chairperson and board member of various national level institution like NIT Kurukshetra, IIT Roorkee, IST Kolkata, and a few more. So with this background, I will request Tejaswini Madam to share the views about AKP. You are on mute. You are on mute.
Yeah. So, namaskara. A very warm welcome to all of you. It gives me a great joy to welcome each one of you for today's edition of Nation First Dialogue, an initiative of Anant Kumar Pratisthana. At the heart of today's gathering lies a simple but yet profound mantra, Nation First. And Anant Kumarji lived by the principle Nation First, Party Next, and I Last. It is in this very spirit Anant Kumar Pratishthan conceived the Nation First Dialogues in memory of Shri Anant Kumar, who lived every moment of his life in service of this great nation, Bharat. Anant Kumarji was not just a leader, he was a visionary karma yogi, whether in parliament, in governance, in public life, which he started at the age of 16. He firmly believed in action rooted in values and service driven by purpose. As a 6-time member of parliament from Bangalore South, he won the hearts of the Bangaloreans, not just because he brought international airport to Bangalore, not just because he was instrumental in bringing metro to Bangalore, not only to Bangalore, to many cities, many other cities, not just because he got it implemented, the 3rd and 4th stage Kaveri, or solved the decade-old dispute between Tamil Nadu and Karnataka about the Kaveri issue. The people of Karnataka loved him not only because of his extensive travel throughout state, especially when he was in ABVP and early BJP days, on cycle, on the red bus. Not only because he built BJP in Karnataka literally from scratch. They loved him not only because he served as a bridge between Karnataka and Delhi, tirelessly voicing for the state's concerns at the national level. And also the people of Madhya Pradesh, UP, Bihar, Delhi, Maharashtra, and many other states respected him, not only because he worked closely with them as a National General Secretary of BJP, longest period of 12 years. He traveled extensively throughout these states, working late hours with them, not only because he brought in a revolution as in the fertilizer sector through neem coated urea, or increasing the production of fertilizer in India. And the most important, it is not just they loved him and even today they remember him, is because he brought in the thousands of Janaushadhi Kendras, making essential medicines affordable for millions. But above all, because of his friendly nature, his clean image, his ground level connect, his rare ability to engage in meaningful dialogues with everyone. That's the reason why people still remember him, love him, a man with great humility and simplicity. And that is what made him a true leader. And in his memory, we established, his friends, his family members, his party workers together, we founded Anantkumar Pratisthana. And Anantkumar Pratishthan's the flagship program is Nation First Dialogue. Along with that, we have various other projects. We are developing a course on under AICTE. It is basically in three areas. One is on the temples as social centers. The other one as the about the inscriptions, and another two courses which we are developing for graduate students is the leadership lessons of the ancient rulers of India. And we have a project by name Grama Chaitana, wherein we have basically for the rural transformation initiative, mentoring and training women leaders from rural areas. We have already conducted more than 10 programs in Bangalore and in Hubli. Another project of ours which we have been running since last 5 years is Anantapatha, our monthly magazine about the about Anant Kumarji's life, about various projects of Adamya Chetana and many other relevant issues. The other program of other than the Nation First Dialogue, of course, this is 14th Nation First Dialogue. We have covered quite interesting topics: Atmanirbhar Bharat, 5G opportunities and readiness, nutrition beyond hunger, balancing development and conservation, and every dialogue of all these 13 NFDs have been interesting. We have been able to influence the public policy at large. And coming back to Adamya Chetana, which was founded by Anant Kumar, because these are the two organizations, we go hand in hand. Adamya Chetana was founded in 1997 by Anant Kumarji in memory of my mother-in-law, Srimati Girija Shastri, who was a committed social worker. We started as a small NGO. In 2003, we entered the midday meal sector. From 2003 to till date, Adamya Chetana proudly says we have cooked 75 crore meals till date. And we have 5 kitchens in India. All put together, we every day cook for 150,000 people, both underprivileged children from our underprivileged sections of the society, and also we run 9 Annadana centers. So we have one kitchen in Bangalore, which is 100% zero garbage, and we don't use petroleum fuel for cooking. Since last 15 years, we have not even allowed 1 liter of diesel petrol or one single LPG. The kitchen, which was using 50 cylinders a day, has decided that we go 100% fossil-free fuel-fed kitchen. And our entire fuel comes from waste material, basically briquettes, pellets, and biogas, and the coconut shells, which are in-house generated. On the one side we are fossil free, on the other side we are 100% garbage free kitchen. Every gram of waste, the so-called waste that is generated, is put in for use, and from this zero garbage kitchen we graduated to plate bank, or we call it as Anant Green Lifestyle Research Centers. Why should only be kitchens with zero garbage? Dinings also should become zero waste dinings. And again started by one plate bank. Today we have 26 plate banks, including one in IIST Shivpur, one in Dehradun, one in Bilaspur, Himachal Pradesh, and all others in Karnataka, around 14 in Karnataka. And our second kitchen, which we started in 2005 in Hubli, covering 70,000 children on a daily basis. Third kitchen in Jodhpur in Rajasthan. Fourth in Kalburgi in Karnataka, back in Karnataka. And last year we started a small kitchen in Ayodhya in UP, and we were blessed to serve prasada at the Prana Pratisthapana day of on January 22nd of Ramlala in Ayodhya. And recently on our 500th Green Sunday program, we planted 60 Sita Ashoka saplings in Ayodhya. That's our another flagship program. And I request all of you, those are joined from Bangalore, please join us tomorrow for 501 tree plant, 501 first Green Sunday. We will be planting 501 saplings on Kanakpura Road in Shankar Mata's premises. So all the things are getting ready. I invite you to join us. The details are available on the website adamyachetana.org. And also Adamya Chetana runs a wall magazine for school children. So there are a couple of projects wherein we try to cover the three main sectors of our life, Anna, Akshara, Arogya, and also Prakriti and Sastuti as the main pillars. With this introduction of Adamya Chetana Anupar Pratisthana, I would like to welcome all of you again for this today's session, which is most essential, relevant, and a timely, event from prevention, detection, and cure. AI, IoT, robotics, eDevices in future healthcare. And I'm thankful to Professor Partha Pratim Chakraborty ji. When I heard you talking about this in Calcutta, I felt, yes, this is the topic which is like, especially I'm part of the Shankara Cancer Hospital. I'm one of the founder trustees. And the day when our first robotic operation happened, we were all worried. I was especially worried how it will be received. And now, when I just in 1 year, today literally even the patients are looking for robotic operation, or even the doctors. Almost all the hospitals today are like eDevices have become so common. So we were, our engineers, generally electronics engineers, while I was studying, we were keeping ourselves away from medicinal field, biology, but it is so close now and be able to contribute so much to this sector. So I really want to, we all are looking forward to know more about it, hearing from our esteemed speakers, Dr. Shri Dileep Mangsuli ji and Professor Partha Pratim Chakraborty, who will not only inform us but inspire us to think boldly, act ethically, and serve collectively. I once again welcome all of you. I welcome our welcome Dr. Indumati Rao ji. I welcome Professor P.V. Krishnabhat, who is our chairman of Anupar Pratishthan. Welcome all. Thank you.
Thank you. Thank you so much. Thank you so much. Now I'll request Pradeep ji to brief us about our this NFD and earlier NFD, and also I'll request him to introduce the speakers.
Okay. Yeah. Namaste, everyone. It's my privilege to welcome you once again to this 14th edition of Nation First Dialogues. And when we say 14th edition, see, we started our first NFD session was during the pandemic in August 2020. In fact, we had just gone past the first lockdown, and so the topic was leadership during a pandemic, how India has handled it. And for the inaugural session, we had none other than the then Central Health Minister, Dr. Harshvardhan ji, joining us, and shared his thoughts and experiences of this on this topic. And since then, we have had the Nation First dialogue sessions. The overall theme or concept of Nation First dialogues is primarily to identify a topic or a subject which is of interest for the overall society across various walks of life, wherein the impact of that topic may be there in everybody's lives at some point or the other. and throw light on that, as well as also identify areas, identify points which could probably help in policy formulation covering these aspects for betterment of the society. So keeping this in mind, so we have normally our Nation First dialogue sessions are attended by participants across different domains, different disciplines, different age groups, from probably from students to farmers to technologists and medical and legal professionals to policy makers. Many times we have had presence of ministers, MLAs, MPs also participating into our sessions, and we normally compile the proceedings of our session and also circulate and pass them on to the concerned people both at the administrative and governance level. So that being the case, so we put a lot of effort in ensuring that we get the right speakers and right set of participants into this activity. So, session two, our NFD second session was on balancing the development and conservation, science-based approach towards policy. Then we had third one was in artificial intelligence in public life, where we had Professor Rajat Moona, then the director of IIT Bhilai. Now he's at IIT Gandhinagar. And we had Ms. Vijaya Deepti, who was CEO of Tata IQ, participating in that. Another session on Atmanirbhar Bharat, 5G, opportunity and readiness, addressed by Shri Rajiv Chandrasekharji. Then he was an MP. Later he became a minister, as well as the then director of IIT Kanpur, Professor Abhay Karandikar, who is now the Secretary, Department of Science and Technology. We also had sessions on nutrition beyond hunger, India's puzzle of surplus food and low nutrition, where we had speakers, coming from one joined from the US, one from Middle East, and also the experience of Adamya Chetana in the food chain. So Dr. Tejaswi Anandkumar also was one of the speakers there. We had opportunities and challenges on Indian pharma sector. Dr. Mandar Kodgule and Sri Deepak Sapra joined us in July 2021. And when NEP, National Education Policy, was released, so we had a session on NEP, Future of 30 plus crore Indians, where Professor M.K. Sridhar, who was a member of the drafting committee, Professor Srinivas Balli, Dr. Vishnukant Chetpalli, and our chairman, Professor P.V. Krishna Bhattji, Dr. Indubati Rao, who is also joined us today, and Dr. Valli Sherur. So they were all there talking about the new education policy and its far-reaching impact. We also had two sessions on Kashmir. One was on the rebuilding Kashmir, expectations and opportunities, where we had Shri V. Muralidharan, Union Minister of State for External Affairs, who had joined us, as well as we had Shri Ashutosh Bhatnagar, Director, Jammu Kashmir Study Center, Shri Girdhari Lal Raina, ex-MLC of then Jammu Kashmir State, Srimati Sahana Vijay Kumar, a noted author, a Kannada author who has done extensive research on Kashmir and published a book, as well as Sri R.K. Mattu, who is a journalist, and he spearheads the activities of Kashmiris who are now settled in Bangalore. We also had a collaborative innovation, win-win for all, not a zero-sum game, in which Shri Nipun Mehrotra, who was the former CDO at IBM, Shri R. Srinivasan, senior journalist and former editor of Hindu Business Line, as well as Dr. Buddha Chandrasekhar, chief coordinating officer of AICTE, participated. We had a session on ChatGPT when ChatGPT had just come in, where we had Professor Sadagopan of IIT Bangalore was the key speaker. We had a session on Uniform Civil Code where Justice N. Kumar, Shri Anand Ranganathan, as well as Mrs. Lakshmi Iyengar were the speakers. The last session that was held was on data privacy and national security. So primarily, India has come out with a DPDP Act where we had Dr. Gulshan Rai, Chief Information Security Officer at the Prime Minister's office, as well as Shri Supratim Chakraborty, who is part of the Khaitan and Company. So they spoke about the data privacy. So with this list of the last 13 editions, now we are on the 14th edition, which is on the prevention to detection and cure, AI, IoT, and eDevices in future healthcare. And I have privilege of inviting Professor Partha P. Chakraborty as well as Shri Dileep Mangsuli as speakers for today's session. So the way we would go about is we'll have Professor Partha Pratim Chakraborty speaking first for about 15-20 minutes, and then I will invite Shri Dileep Mangsuli to speak for 15-20 minutes. And so subsequently we'll have more topics covered, more aspects covered through question and answers. So we feel that would be more interactive in nature. So let me welcome Professor Partha P. Chakraborty. A brief introduction about him. Dr. Chakraborty completed his BTech and PhD from Computer Science and Engineering Department of IIT Kharagpur. He joined the same department as faculty member in 1988, and he is currently a senior professor there. For a period of 6 years, he was also had the responsibility as director of IIT Kharagpur, and he has held various responsibilities in these last 40 or so years at IIT Kharagpur in setting up state-of-the-art VLSI design lab. Huh. Yes. Yeah, so he held an additional charge as director of IIT Patna and IIIT Kalyani as well. His areas of interest include AI, algorithms, formal methods, CAD for VLSI, embedded systems, etc. And in fact, there's so many things to his credit. I mean, he has received President of India's Gold Medal, the INSA Young Scientist Award, Anil K. Bose Award, Shanti Swarup Bhatnagar Prize, and a number of more, such recognitions throughout. So I invite Professor Partha Pratim Chakraborty to address us and share his experience with us on this relevant topic. Over to you, Professor Partha. Thank you.
Pradeep, yeah, namaste, Professor. Just I would like to invite a couple of the dignitaries, Dr. EVR Raju, who is a expert appraisal committee of Ministry of Forest Environment, has joined us. Dr. Chitra Ravi, many other people are there. I welcome all of them. Sorry, please go ahead, Professor Partha.
Thank you. Thank you. Namaskar. Uh, I am extremely grateful to Dr. Tejaswani ji, Pradeep ji, and the whole of the foundation for inviting me to this such an important and interesting dialogue. I am also extremely nervous that so many dignitaries are there, but I will. The topic today is such that it's about artificial intelligence. And the way we have structured it is that I will talk a little bit about artificial intelligence and its effect and its application to healthcare. And the real doctor will then take over in terms of how to take this forward and translate it into policies. So Dileep ji will follow me. So I will share my screen and start if it's okay with everybody else. So good evening, everybody, and thank you for joining this again. The title of my talk today, brief talk, is on artificial intelligence and machine learning in medical science and healthcare technology. Artificial intelligence is the craze of the modern world. It has made science, technology, learning, and everything else appear simple, straightforward, as if you are asking a question to somebody else. But deep behind this lies technology that is unbelievably complex, mathematics that is extremely deep, and science that assimilates everything on earth together. Earlier, we had taught different disciplines, we used to learn different subjects, but modern artificial intelligence has integrated all subjects together into a single framework such that you can ask a physics question example using nursery rhymes. So artificial intelligence as of today stands, is the next slide visible? Has my slide
No,
come?
no, no,
No,
not
sir. No, sir.
not come.
Not come, no? Wait, let me reshare again. I think uh, the sharing was not correct. Just give me a moment, sir. Yeah. Yes.
Yes, sir.
So, there is something called Murphy's Law. Murphy's Law says if something can go wrong, it will. So, a computer scientist makes mistakes on simple things like displaying on screen. So, pardon me. So, artificial intelligence at the top right, you will see, like in all philosophies, a star. So, this is the star of artificial intelligence. The star of artificial intelligence hinges on one triangle which is based on knowledge, which is represented, the solving, and learning. Here is the power of AI, where it integrates all knowledge, whether it is physics, chemistry, biology, language, or anything, into a single representation and integrates all knowledge. Then it has a unified solving methodology and a learning methodology. And this learning improves the knowledge representation and solving. Knowledge improves solving and learning, and more solving provides more knowledge. And among the technologies today are algorithmic, which is called symbolic, statistical, which is called data science or machine learning, and a copy of the neural system in a mathematical format, which is called connectionist or deep learning. With this, artificial intelligence brings together everything. But one thing that we have to remember is that with all this, the solutions to artificial intelligence is probably approximately correct. It is sometimes perfect, sometimes inaccurate. And it is this that has to be remembered when we have to use artificial intelligence, especially in healthcare. So artificial intelligence is able to transform all domains, is able to model complex processes, is able to assimilate knowledge and discover patterns on its own. And with three powers: the first, technology, which made computation, storage, and communication free. It has made computation free. On our pocket, we have this mobile phone, whose power is just enormous. Even 10 years ago, the biggest computer was having less power than what we have in our mobile phone. Storage, we have petabytes of storage in our disposal, and communication is almost free. And based on that, AI has been able to defeat humans in almost all activities and games. AI is able to now communicate in such a way that the other side will not understand whether it's a human being or not. We just heard a little bit about telesurgery. Today, an aircraft, its complete model while it is flying is available, predicted, and we can see what happens. Here are some examples. The first generated textbook, which was on lithium-ion batteries, and is the most authentic textbook till now, is completely generated by AI. AI has been used to read scientific papers and make predictions. And by reading scientific papers up to 2009, it made predictions immediately, which was actually discovered by human beings in 2012. Today, proteins, through that AlphaFold technology, proteins, 200 million proteins have been, their structure have come out. 200 million proteins means for one protein, one PhD, 5 years, which therefore means 5 billion man hours of work is done by one machine in one shot. So this is the power and amazing power of artificial intelligence. Such is the power of artificial intelligence that this year's Nobel Prize in Physics and Chemistry have been obtained and received by people who are artificial intelligence experts. And this is not the first time, because in 1978, the first Nobel Prize in Economics was also won by an artificial intelligence person. So any person beyond these domains who have won the Nobel Prize are all AI people, and that is changing the dimension of the world. Research. Today, AI is doing research on its own. It is finding new problems. It is finding solutions to new problems. It is trying to set up what is the experiment required to validate these problems. And therefore, by setting up a new experiment to validate these problems, it is also creating machinery which will develop the experiment to do these problems. And this is used in medical science and research, and I will share with you how such things are happening. Therefore, even today's research, as the claims are coming out, and you may have just heard that the most intractable IIT Advanced JEE exam, the latest GPT versions and the Gemini versions are now, they have appeared in the exam and their rank is #1. So they have beaten the best in the country and the world. And the last thing I will tell you before I move on to something else is that by just looking at brain signals, AI is now able to make sentences out of the thought processes that are coming out. So with this power, naturally, AI has got extreme influence on healthcare and disease. And everything that is related to healthcare and disease has been touched by AI. The scope for AI in this covers a lot of areas, from disease surveillance, detection, tracking, to diagnosis, prognosis, treatment, protection and prevention, vaccine, drugs discovery, patient management, supporting doctors, scenario analysis, decision making, and one topic which is of importance to us today is policy and governance. In addition to that, a lot of knowledge sources. So analytics, robotics, and the topic of today, IoTs, which are integrated with AI into these systems, and therefore they are now called cyber physical systems. Data is at the heart of AI, and therefore healthcare data is gold mine for all of AI activities. The first step in any AI activity, and I will take you through this whole thing through something that enabled our AI to move the fastest, was COVID-19. And all other areas are there, but COVID-19 was the AI enabler for medical healthcare. So suppose I have to do screening, then I cannot do the PCR test for everybody in the country. So there is this funnel. So all of AI goes through a funnel of tests which collects data. Then AI is also used, instead of taking blood test and using one machine for testing every person, one test for every person, there is a very interesting algorithm which came out during this COVID times, where more than 8 tests could be done on one sample, on one PCR test, and that was the AI and mathematics that was coming out. So this was a group test. Then the other is IoTs. So IoTs and AI/ML, for example, if you look at respiratory health monitoring, creation of new masks, embedded masks. How do I create masks in such a way that they are able to detect whether somebody is infected or not? So smart masks, cough detectors, then even from speech, even from breath, even from breathing, people were able to start detecting. So a lot of IoTs, very simple things. There is a very good software which came out of IISc Bangalore, where even from cough, people can detect. Even from your speech, people can detect certain kinds of disease. Then comes testing. How do I test at the point of care? That means how do I test everyone at their home using a low cost device? So here is the technology. High cost experiments are performed. Based on these extremely high cost laboratory experiments, correlations between the experimental data, the chemical reactions, and the chemical tests, and color that comes out of these tests is done. And this is loaded into a machine. And using these microfluidics, this is part of a work at our IIT Kharagpur microfluidics lab, where you take it through a microfluidics, and at the point of care, it is just a small device on which you pass on your saliva or any other such equipment. And from the color, the AI automatically detects with 90+% accuracy about the disease. So this is an extremely low cost AI-based technology where the machine has been learned, has been taught from the data of the lab experiment. This is my student who runs Tejaswani in Bangalore, a company which does digital microscopy and pathology. He makes the whole equipment at 1/10 the cost of the top line machines of the world with the same accuracy. Today, eye diseases are solved by AI, by simple imaging fundus eye images, and their methods are now better than even a combination of good human experts. In the epidemic management, the whole of biology, there is this whole chain, as was being mentioned by Pradeep ji when he started, is diagnosis. From the diagnosis, whether it's cough, sound, blood exam, diagnostic images, then drug discovery. How do you discover new drugs? How do you repurpose old drugs? And the third is clinical management. How do you manage people? All of this is now integrated into AI frameworks, and I shall elaborate on them quickly. So this is a imaging-based technology for X-ray imaging for COVID. Robotics gained a huge fillip in COVID times, and now they have been started getting deployed in other places as well. And we know about robotic surgery, we know about eye surgery, Tejaswini ji just mentioned. Then comes drug discovery. Drug discovery has been accelerated by looking at candidate molecules, running AI/ML driven predictions. Based on these AI/ML driven predictions, based on its accuracy, efficacy, and safety, then we figure out whether we go and take it right into the field, or we again go through more detailed simulations, or we go through experimentations. This is the cycle that is used for drug discovery. The other interesting technology is drug repurposing. One type of drug which was probably used to treat, say, uh, one disease, by using that drug, by making slight modifications and using whole of AI ML to understand the expression profiles and go through the trials and go through all that analysis, is used for COVID and many other diseases. And in COVID, we know that one or two of these drugs itself was produced by drug repurposing using AI ML techniques. India, as we all know, has won accolades all over for vaccine management. In terms of deciding who will get a vaccine, how to maintain the cold chain, whom to provide, how much to deliver, what inventory to keep, what is the logistics to be done, and point to point time resistant so that you don't waste a single vial. You don't take one vial and give it to one person because it contains for 5 people. And all of us who have gone through it may not be aware of this detailed AIML methodology that has been used to track, detect, make sure, hire ambulances, the whole of logistics and everything else. While this is not related to drug discovery or detection or something else, but was a lifeline for our system. And India has won accolades all the world over for its efficient vaccine management. Another interesting part is these chatbots and help desks. This is a screen of the chatbot that we had developed, and we worked with MyGov and others on how to take patients, how to answer their queries, how to work with doctors, how to connect with other agents. So this whole language side of the chatbots, which is another part of the modern AI, was used. Remote patient monitoring. This is where all the IoTs and everything else comes into the picture. So remote patient monitoring, creation of these ambulances, providing information to doctors, nurses. And today, in the world all over, we see that this remote monitoring, especially of old age patients, sick patients, is fully enabled by the IoTs and AIML. Today, we now have virtualized clinical trials and home management. So at the home, you are at the home, you are quarantined, you are sick, or you are. So how do I completely give you a virtualized caregiver? How do I create all these simple platforms by which you can follow all the medical protocols? Medical is not like going to a class and taking education and coming back. Medical requires certain extremely important guidelines to be followed. So how do you do clinical support? How do you do all the conferencing, consenting, providing these things? This whole backend is a very interesting and other way to do things. AI has got three legs. One is called augmentation. That means AI assists the human. AI will tell the doctor that this is what I feel, these are the three scenarios, and an expert doctor or somebody else will take a decision. The second, as you are able to see in many cases nowadays, is that AI will do half the screening itself. Today, if you violate a traffic signal, AI completely, up to the fine, AI takes care of it. But this is human as a system. That means AI has started taking decisions, but not all decisions. Certain decisions can be blocked by humans. The third is full autonomy. That means system as a human. That means the whole system uh, performs autonomously. So as we move to complete autonomy, we have to start remembering the following, that AI is not infallible. Here is an example of a topic that I work. Here is a pig. I will change only 20 pixels of this million pixel picture, and AI will predict it to be something else. So which means that there is a red light, and I am seeing human being is seeing red light, but AI has been adversarially attacked and will see green light, and the car will automatically move. In medical science, he will read this the picture, and looking at the picture, they will think that diabetes insulin is not to be given, but actually there is something else wrong, and that person may die. And these can be attacked. Therefore, AI is not safe unless you make it safe. And in areas of safety critical systems like healthcare, we have to remember that AI has to be taken with caution. Therefore, today's AI needs to be robust, reliable, responsible, explainable, and interpretable. And in medical science, it is more so. Before I end, I would like to say that for India, this IoT AI ML combination is provides enormous benefit and enormous opportunities. I give simple challenges. Today's one challenge India has almost met is that I will talk to Tejaswini ji in Bangla, but she will hear it in Kannada. And she will speak to me in Kannada, and I will hear it in Bangla, all real time. Madam, this is national integration at its highest. There cannot be better national integration than this. Secondly, I will give a challenge to all AI people. Make a stethoscope which can be used by a woman at her home, where she goes through this, uses the stethoscope, and if she has done anything incorrectly, the stethoscope will say, no, 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 go a little right, press it here a little harder. Ah, now I got it. And you make these devices talk. Make these devices talk in their local language, in their natural language, and make these devices low cost. India will change the world. India has changed the world in many, many cases, and this is an opportunity for us. With this, I thank all of you for inviting me to this seminar, and I look forward to hearing Dileep ji speak and look forward to participating in the further sessions. Sorry if I have taken too much time. Teachers are always like that. No? I have to stop sharing.
Yeah, thank you. Thank you, Professor Parthaji. I mean, it is a good insight into the AI ML driven systems. And as you rightly said, AI predicting a false negative is more risky. And I think that's where we need to look at even the things or at the policy level also what kind of standardizations and what kind of standards we bring in to certify these safety critical systems. Yeah, so I think that, and more, of course, I'm sure more questions will be there, when people will interact with you. Okay, thank you so much. So now it's my opportunity to invite Shri Dileep Mangsuli ji. Let me quickly introduce him before handing over the mic to him. Uh, Shri Dileep Mangsuli is chairman of Cancer Treatment Services International Group, which is an American Oncology Institute, Citizen Specialty Hospital, and Ampath Labs, which is focused on providing quality cancer treatment to patients in markets. So this is part of a subsidiary of Siemens Healthineers company. Shri Dileep is also Senior Vice President of Access to Care at Siemens Healthineers. He is focused on building accessible solutions through innovations in technology and partnership. So earlier, Dileep has headed the Siemens Healthineers Development Center, uh, which is based in India as well as in Slovakia, leading a team of over 5,000 technologists, building healthcare solutions in imaging, diagnostics, and digital technologies. So whatever Professor was talking about, the new research and all, lot of this bringing them into day-to-day lives is something that Dilip has been doing it throughout. Earlier, he was also the CTO of Wiproji Healthcare South Asia, delivering cutting-edge technology and product solutions to global and local markets. So, in fact, he has an engineering degree from Bangalore, UVC, and a MTech from IIT Madras. So for the last 30 odd years, he's been focusing on product design and engineering and business solutions. And as a market leader that his company is, I think it would be definitely wonderful, and we look forward to hear from Mr. Dileep Mangsuli. So over to you, Mr. Dileep Mangsuli. Thank you.
Thank you. Thank you very much. I think it was very interesting to hear Dr. Partha's lecture. Even after having worked on technology so many years, whenever you hear from professor, you want to always listen to them because they bring in such a wider aspect of impact. That was great. And the last point that he talked about, India, which will become a future of healthcare innovations, I think that I fully agree with him. I can tell it with conviction also, because I, as a leader from Siemens Healthineers, I can say, having worked in healthcare industry for the last 10 years now, Bangalore alone has more than 60, 70,000 healthcare technologists who are working on cutting edge technology. Many of these technologies don't see the light of the day in India, but they see the light of the day outside the country. But it is an opportunity. With the advent of new technologies, this is going to really change. So what I want to do in next 15 to 20 minutes, I will try to really give a more context in terms of what's happening in terms of the population as well as the needs of the market and how these new technologies are going to shape the accessibility and affordability for whole world. And India is going to be the forefront of it. So let me share my screen. I hope all of you can see my screen.
Yes.
Great. So like Professor was saying, Murphy's law always works. Yeah. Great. I think one of the biggest challenge we have always seen is more than 50% of the world does not have access to healthcare even today. In 1978, there was a World Health Conference that happened in Almaty in Europe. And during that, the entire world, the government, the private organizations, the NGOs, everyone took an oath that by year 2000, we will make healthcare accessible to everyone in the world. And today, it still is not the case. Nearly 50% of the world has a challenge of access to healthcare. And we saw this even more drastically during the time of COVID, during 2020-21 time. Now, the challenge is also about, how this is really impacting, give you an example, 50% of the expenditure on healthcare that happens in India today is out of pocket. And the very startling number states that nearly 25 to 30% of the people go below poverty line when they go through one of the challenging diseases like cancer or a heart or a neuro disease. If they go through that, their entire family comes below poverty line. So that's a huge challenge. The healthcare is not affordable today, and access is also a huge challenge. I had a chance to travel to Philippines just about a couple of months back. And there, the first level of support for someone to get in terms of even primary healthcare, people have to travel 100 kilometers by sea. There are over 1,000 islands, and not every island has the healthcare facility. This makes it really challenging. This is the reason why people are trying to look at where you live should not determine if you live. This is a very, very powerful statement. And I personally feel very connected to it when I have seen a couple of very known people who passed away when they could not get the help when they needed it, because they were not near a facility where they could get immediate help. It was not that they were not in, they were in the city, but they could not really get ambulance also in time. There were also people who had fortunate experience of having an ambulance next to them from our office. A person could be saved when we shifted a person who was having a heart attack within 7 minutes to a hospital, and he was saved. So this should never be a case for anyone. Where you live should not determine if you live. And the other challenge, if you think about it, healthcare has become expensive, and healthcare also is making it a hugely challenging worldwide, is because there is so much of wastage in healthcare industry. There is at a conservative estimate, 25% of the hospital costs are not really needed. They are the waste. And there's a challenge of variation in diagnostic. There is a challenge of uh, lack of clinical expertise, challenge of, does a person know craft of medicine, the challenge of unnecessary tests. At a very conservative estimate, US alone loses nearly $3 trillion of money because of healthcare wastage. Now imagine the entire world, how much money. And India itself, we know that every time we go for a certain diagnostic requirement or a test, the challenge is we go pretty late. And when we go late, we enter into a situation where the spends become too huge. So this is putting a huge challenge. Now think about it. Today, we are a hugely populated planet. And by year 2050, we are going to touch nearly 10 billion in population. But the most disturbing thing is we are going to be short of nearly 18 million healthcare workers by the year 2030. This is a very challenging situation. Even today, the number of healthcare workers available is hugely challenging. I can tell you from my example, the challenge is so huge. Healthcare industry sees a attrition of nearly 30% because there is so much of demand and people just keep jumping from one hospital to another hospital. So 18 million is going to be a shortage of healthcare workers. When I say that, it's a clinician, radiologist, nurses, and you name it. And this is not going to really help us. But the good news, computational power, it's going up exponentially, and the internet connectivity. These two are the boon for the entire world. What we are losing out in terms of the skill and in terms of increased population, we are probably going to gain through technology. And here is where we'll be talking about this is the impact that is going to be created across the world. And Dr. Partha also talked about AI's impact in multiple areas. Now, I'll give you this example of number of chest X-rays that are taken globally is nearly 3.6 billion chest X-rays are taken every year. And nearly 74% of these X-rays are normal. But imagine every radiologist needs to spend time on every X-ray because for that patient, it is 100% health requirement. Now, if that 74% of time is reduced, then there is an opportunity for this doctor to spend time on the people or the patients who need addressing this. We call this as no actionable disease, NAD. So we have developed algorithms now today which are able to screen the X-rays and tell these are normal, these are abnormal. If it is abnormal, that's where a clinician needs to look at it. If it is normal, no action needed. So you just move on. This is a hugely life-changing experience for radiologists. I'll give you one example. We talk India to have a challenge of X-ray or diagnostic facilities or imaging facilities. Imagine UK. UK is considered to be an advanced country. But even in UK today, once a person's X-ray is taken or a CT scan is done, for report to be generated, it takes nearly 2 to 3 months of time because there are not enough resources available, and that makes it really challenging. Here is where AI will come into play. AI will come into play in building reports which can be helping them to make the right decisions. They can look at NAD, no actionable disease here, move on to the right ones, and have a focused effort on the right patients. This is something I'm really fond of this particular chart. This looks like a galaxy, stars, but it is not. Actually, this was a University of Essen in Germany conducted this particular study. You see some red letters here. They're all very small. Every red letter here or red sentence is a report or a test data or an image that is collected for a patient. And this particular data is then connecting to various nodes. These nodes are different doctors, different departments, labs, radiologists, and multiple people. This data, interestingly, belongs to one single cancer patient. Now imagine this is a complexity which in the third dimension is going to be a time dimension. The dimension of the spread of the data to different departments, different experts, and different time. If you look at it, how does a doctor, when he is looking at data coming from multiple sources, can he make a decision? Can something be done to generate a better insight for him to make a decision? Here is where again AI and technology comes, where an excellent insight can be created. And that can really lead to a better outcome for a patient because a clinician does not have to spend too much time to go through the depth of data, time-wise as well as spread-wise. This is a hugely impactful. This is last couple of months back, I had a chance to visit a few health camps that happen in India. I went to Haridwar. Near Haridwar, there was a small village where NGO was conducting a health camp with help of government, local government, and ASHA workers. And what you see here is a very interesting use of technology. Many of you may not know today that TB, everyone thinks that it is a disease which is gone out of this world. But you'll be so wrong. TB is still prevalent, and nearly 11 million patients are today active TB patients, and nearly 25 to 30% of those patients are in India. And there was a target to eliminate TB from the world by the year 2025. Unfortunately, it has not happened. A new target has been set to eliminate TB from the world by 2030. Now, how do you do it? You have to go find out, screen people, and find out if someone has TB, and then put them through treatment. Now, TB testing is very challenging. You have to know who has TB. Sometimes symptoms are not visible. X-ray is the only way you will be able to find out if there is a chance of TB, and then you have to do the sputum test. Now, X-rays are not easy, but technology today has made that possibility by creating ultra-portable X-rays. You see a small X-ray unit that is standing on the left picture. X-ray unit which looks as small as a digital camera. And this can capture image, and that can be then screened with AI, which will within a minute tell if a person has positive TB or not. The moment one detects it, then it is taken for sputum test and the person goes through. It's an unbelievable use of technology in smallest of villages where people carry this on a backpack and do this. Many people don't even realize how AI is changing the world and AI is changing India. This is unbelievable. I have seen this even in Chamarajpet district. I went and visited a few test camps, and it was very impactful. The other uses, I talked about, capabilities. How do you increase capabilities, local capabilities? Through technology, remote management of devices and technologies is going to be the future, where X-rays and CTs and MRIs can be run remotely. This is going to help in building skills where none exists. This is a challenge today. Drones, as all of you know, are really making a huge impact. We saw a lot of drone impact during war, but during peace, I think this is where you will see, we are working from Siemens Healthineers in delivering test samples, delivering diagnostic test samples from one place to another place in Kenya and different parts of Africa. We are trying to look at how these can be impacted even in India, because when there is an immediate need for building these kind of early tests to be done, and some test equipment may not be there, drone can do this very quickly when traffic challenges are there. Learning is a big challenge, especially as I told you, the turnover of employees in hospitals is a huge challenge, and virtual and AI-driven learning are going to be the future. Why I say this is, I'll give you an example of Tesla cars. Tesla cars have a very unique feature. If Tesla cars are self-driven, they drive automated driving, and whenever they go through a particular street, and if they detect something there which actually causes a driving challenge, it learns immediately, and that learning is imparted to all Tesla cars worldwide. So next time any other car comes in that way, if there is a speed bump which has come in, that learning will go quickly to the other units. And that is something which actually makes every Tesla car better every day. Now, even in customized learning, someone learns something on nursing or clinician, can that be imparted back to other people to learn something new? Because these factors of age, factors of genomics, and many more things can really bring in a better impact. So it's an unbelievable way in which it can really create an impact in terms of learning and skill building. So these are areas where there's already a huge amount of effort that's going on from many companies. You can look at this image. What you see on the right side is an image that has been generated with CT scan. And on the left side, how a CT scan looked in 1974 when it was initially introduced. And today's image, this is cinematically rendered image from the CT scan which has been taken. Because of the computation abilities, you are able to see the image of a person which has been taken with CT scan. And this is a level of details that imaging can capture. It's because of technology of capturing and computing and rendering that is created. So which makes it so easy for a clinician to make the decisions. This is unbelievable impact of technology that has been created. Now, this is where, before I jump onto this, I want to bring in digital we talked about, data I talked about, AI I talked about. For AI to be successful, one of the biggest requirement is about data. Without right data, you can't create AI. If you feed crap, you get crap as a result. How do you get a structured data? How do you create learning which is going to be more impactful and more direct? And here is where I think a lot of effort is happening in many countries, and even in India, many of the hospitals are changing to a better annotation of the data, because if you don't annotate data and create a structured data, it becomes very difficult for it to be used. Everyone knows data is future oil. This is gold for everyone. And the change is going to really create an impact with this kind of a thing. For you to know, Siemens Healthineers has collected more than 2 billion patient data for building AI algorithms for multiple areas. Now that is about data, AI, and digital. Now think about how is the future going to look at? Future is all about, you need to really look at how is today's healthcare. Today's healthcare is all about reactive. We do healthcare solutions based on a disease. We today manage a disease. Can we get to a point where we are able to predict what is likely to happen? And here is where patient twinning is going to come into play. When I say twinning is about, we are in Bollywood, we are very fascinated with twins. You give a pinch to one twin, the other twin feels the pain. And here is exactly what we are thinking about twinning. Twinning is not new in technology. Uh, in real life, I think for aircraft, this was used for last 10, 20 years. This has been used where a aircraft engine gets twinned in real time. And when it lands on the ground from a flight, everyone on the ground knows if the engine is ready to fly or it needs a repair. A similar thing, patient twinning is what the North Star is for the future. Now, this is going to require a huge amount of data. It's not going to be just about data about health statistics. It's going to require data about your consumption, data about your mental health, data about many more things. All details about surroundings, the temperatures, many more things. But all the data is available, but how do you get it? It is going to be a coordinated effort of multiple companies, which will create a future twin. Future twin is going to be residing on your handheld device, a phone or a watch, where the diagnostic or analytics will happen on the cloud and will give you real-time warnings of what is likely to happen within early enough. Like, for example, a couple of days before, someone may have a heart attack or there's something which is going wrong for a person to take early decision. And that can lead to a precision therapy. And that's where our costs are going to come down. See, it's all about where do you treat a patient? Do you treat a patient when he is in a advanced stage of disease, or do you want to treat a patient in an early stage of disease? The moment it comes to early stage, the costs are always going to be lower. And that actually brings me to a very, very interesting experience I had when I lived in China. In Shanghai, I had an experience of interacting with locals. And in China, they had a very interesting, not interesting, I mean, it's a very common practice. Even in India, we have a family doctor, concept of family doctor. A family doctor, as all of you know, is one who is taking care of the entire family. And he's designated family doctor because he's the only person you go to. Even in China, it is there, but a very different concept of payment for them. The concept for them is about paying them a yearly subscription fee is given to this family doctor. And if there's a catch to it, if someone in the family falls sick, there's a deduction in the yearly charges to the doctor. If more people fall sick, there's more deduction. So that means this doctor is incentivized to keep the family healthy, not treat disease. I mean, that changes the behavior. Your rewards will decide your behavior. Today, our rewards to almost any healthcare industry is about how long you treat the patient. More you treat, more longer you treat, more rewards you get. But here in the concept of China was about how quickly or how well you manage a person's health rather than how well you manage the disease. And that to me was very, very interesting. And here is where I think, to me, the biggest change that's going to happen in India is going to be about National Digital Health Mission. This is where we can become a leading light to the whole world, because with National Digital Health Mission, we are going to create a vertical data of patients. And a lot of data that is going to come in is going to create ability for any doctor to create a insights on a patient based on the vertical data, which will make him like a family doctor. He doesn't have to really understand anything more. The data, which is going to be all across from his young age to old age, what has happened, what are his challenges in terms of health, everything will give insightful details to any new doctor wherever he goes. And this is going to be a game-changing thing for the world. There are challenges. I'm not saying these are not without challenges, but I think few of the things that the government has also made, the data belongs to patient, and patient will be able to give it to anyone he wants to manage that. And that is going to really change the way it is looked at. Privacy, security of data, that's going to be managed by the government. And this ecosystem of digital health is going to bring in multiple players who can use the data to create a better health to India, better health to world with the example. And that to me is going to be a game-changing thing for all of us. And I'm particularly excited as I sit in my role today, looking at nearly 130 to 140,000 patients we treat with AI, with multiple digital solutions in treating cancer. And we are looking towards a better world where we can treat patients early, we can catch disease early, and we can have more people going back healthy and less people having the bad effects. So I'm excited. Again, I want to thank everyone for giving us an opportunity to share this. And this has been exciting to really talk what I have been thinking with our teams. Thank you.
Yeah, thank you, Dileep ji. It was wonderful. I mean, focused on the illness care to wellness care. How do we move? I think that was a wonderful thing with examples. All right. Yeah. Thank you. Wonderful. And I think over to you, Sujit ji, to take it forward. Q&A.
Yeah. Oh, yeah. Thanks, Pradeep. And it's wonderful. In fact, our both speakers, they only didn't answer 100 of questions, but they have created curiosity in the mind to have 100 more questions. I think that is interesting part of, most interesting part of these sessions. And our audience, they have, I mean, full of curiosity and full of questions. Before I ask the audience to start asking questions, 2-3 things I would like. I request audience to those who are on the YouTube, they can put their question in the comment box. We'll compile from there and then we'll pass it to our speakers. Then another source of our questions are basically while registration, they also gave some of the questions. So we have total 4 sources of questions. One is from YouTube channel. Another is from our chat box here on the Zoom. Third is from during registration, they have some questions. And fourth is also obviously from our AKP team. As a team, we are also curious about certain things and probably we'll go ahead with some of our questions. Before I ask question, Tejaswini, Madam, would you like to, we like to start with some question or something?
Yeah, it was really wonderful the way the healthcare has changed, the precision, the history data, and then the connect, that line where it should not depend where do you live, and also I should say, no, how do you live and whether you live or not should not depend on the money you have in the bank. That's also another factor. Probably the technology, both AI and these eDevices will definitely give answer to that, which is another major thing, that's the cost of healthcare today. So lot of things we learned in last half an hour. We have Dr. Indrani Suryaprakash, who is our quite active volunteer. She had asked a question. Indrani, you would like to say it now? She is written in the chat box. Dr. Indumati ji, would like to add something? Indumati ji, Dr. Raju?
Yes. Yes. Can I go ahead?
Yeah, please.
Yeah. It is really very big eye-opener to look at the potential of technology in the healthcare. I work in the field of disability, and I could, when Dr. Sarkar was speaking, I could see AI can be a very big boon for people with disabilities in rural areas, because nearly 80% they live in rural areas, and there are absolutely no services in rural areas for people with disabilities, right from identification to diagnosis and various others of basic interventions. So AI can be very helpful. I was also looking at positive side of AI, the error, and sometimes it creates fear because it is a health sector and we are talking about our very existence. But there are areas where it can be very low risk and no risk, and AI can be very, very supportive in rehabilitation and support services. The second aspect I'm seeing is there's absolutely a shortage of caregivers. It's a huge problem. So whether AI can be even a partial caregiver at a low cost, if possible, even at no cost, that would be a very big boon for the society, because it's a huge issue, more than lack of doctors. And I see lack of caregivers is a huge problem. So how can we really reduce the cost and take caregiving using AI into rural areas is something which is coming to my mind. So whether we can do more research on those areas, identification, diagnosis, caregiving. And the third area is, of course, we're talking about technology. I was looking at assistive technology for people with disabilities. It could be hearing aid or a wheelchair. Most of the devices, sometimes they are inappropriate, they promote disability. How AI can be more accurate in developing accurate assistive technology, assistive devices, and also assistive technology. We need to look into that. Dhanyavad.
Dr. Raju,
Namaskar, madam. Good evening to all learned speakers. Sir, especially to Partha Chakraborty sir and Dr. Dileep Mangsuli. It's really wonderful because actually I'm now a medical doctor. I'm a doctor from the industry sector concerned with the environment. But this has, as Dr. Surjit sir has told, that this has opened a Pandora's box for questions. Yes, my brain was churning to what type of question should I ask. But nevertheless, recently I had gone to an article in the LinkedIn. There I had read that there is a research by the MIT that due to this AI and chat GPTs, the cognitive recognition abilities of the brain will be reduced. Is it true or not? I don't know. Please, I would like to both the learned speakers to just throw a light on this. And in any way, how this AI will improve our environmental mitigation measures, because I am from the environment domain. So these are the two questions for me. Please, thank you, sir.
Professor, you want to go first, or so maybe let me take this.
Please go, please go.
I'm of the opinion that the brain is very what do you call as adaptive. While AI is going to really bring in certain areas of intelligence that is going to be pre-built, I think we will be moving to the next level of brain usage. I think today we are trying to use, for example, we use brain to really understand if I have to travel from Sarjapur Road to Jayanagar. Today, we put a Google map and we try to go there. Earlier, we used to do mapping and figure out what road I should take and all, do a lot of work before. But with this new thing, your ability to look at other things in terms of what you can do is going to change. While your ability, cognitive ability may change in the areas that were earlier being worked, I think your next level of working is going to be in terms of how do I reduce my time? What is going to be my approach? Should I use a certain route using AI Should I use certain other things? You will be able to start using a different level of intelligence, according to me. We always feel that is it going to really change for us are we going to become less smart? Probably not. I think we are going to become smarter. Some people may end up becoming more dependent on technology. They may not be able to do anything without technology. But I think it is also going to create a new level of intelligence in almost every one of us. But it's going to be about how does one adapt to it. This is, to me, a question of evolution. Professor, what do you think? This is my thought.
Yeah. So the current researchers, we have to look at it very interestingly. We learned something the hard way, and that has become very easy. So now that that has become very easy, for the new generation, we think that they should learn it the hard way again, right? So that is something. The question is, how does it affect the brain and other things? So let me give you a very important perspective regarding AI. The perspective is as follows. Given any problem that you want to solve, there are two things about the problem. One is, can you solve the problem? Secondly, if somebody else solves the problem for you, are you able to detect whether it is right or wrong? Now, if you cannot do the second one, then you are in trouble. If you cannot do the first one, it's like saying that I cannot drive the car, but you are at a steering wheel and an autonomous vehicle is being driven, and you can make out and you cannot make out that it is going to make an accident, so that you take control of it. That is the problem. The problem is that it is not the problem of being able to solve everything on your own. The problem is the loss of the ability to check the correctness of any solution. So this is the fine difference between the loss of ability and the ease of using automation. So, while the MIT study is a study, we have also conducted several studies on essay writing and things like that. But as the native AI people grow up, their brains will get wired in a little different way, as Dileep ji said. So while this whole generation, our parent, this is a little different from not knowing how to multiply large numbers automatically like our parents. This is because calculators were so correct that we never disbelieved that the calculator will give you wrong result. But when you ask for whether I should take this medicine now or not, then AI based, because of its structure, there is a chance it may give a wrong result. So there needs to be a mechanism in modern AI where there is a monitoring, there is an explanation, and there is a verification. Once that comes into the picture, I think it will modify further, because AI is just in its baby steps. In terms of environment, sir, there is huge detection and possibilities. Very early detection, very microscopic detection, and what are the methodologies for mediation, lowest cost. So this whole of this exploration of what to do is definitely a viable thing, and AI for sustainability is becoming a very, very important aspect today. And regarding Indumati ji, when she said, assistive technologies, AI is now the in thing. It is the rehabilitation robotics with assistive technologies is really significantly improving the lives of the poor. And the rich could always afford it, but the poor, for the poor, these rehabilitation robotics, low cost, AI driven, personalized, is going to become a big game changer in our country. The way I'll give you the example is how spectacles changed lives of people. Your eyesight, it changed by just one spectacle, right? If we because it is so common to us, we forget that if the chashma was not there, what would we do in life? So that is going to come up, and these new technologies or rehabilitation robotics are going to come up very, very low cost and very, very well controlled because of 3D printing, integrated electronics, and things like that. Thank you.
Thank you, Dr. Chakraborty sir and Dr. Dileep sir.
Dr. Indrani, please go
Hello.
ahead. Dr. Indrani, Dr. Maitri, and Mr.
Yes.
Prashant. We'll take all the
I'm
three
Dr.
questions.
Indrani here. Sir,
Please be
this is to
brief.
Dr. Dileep ji. I was curious to understand what are the strategies that are, used to control the healthcare wastage that is happening at such a large scale. Can AI in some way help, like minimize these things or whatever?
Yeah,
I mean,
absolutely. Your question also, I was reading it on the comment. Yes, absolutely right. See, AI, I was trying to give you why it'll improve the cost of or wastage it will reduce. I take the examples of early detection, right? Early detection through AI is going to help in giving early treatment. Early treatment is elimination of waste. If you had treated a patient maybe 6 months later or 3 months later, it would have created a much bigger expense for them. That is one waste. Second, in terms of the AI helping in creating a report which are going to be a lot more accurate. Today, even though FDA does not allow report to be the decision maker, the clinician needs to still make the decision, but he can vet it with the AI. So by vetting with AI, he's going to really look at it and make a decision that, hey, is it right decision or not? So there is already a person who is making that decision. There's no need for one more test to be done. The third, in terms of we talked about digital, where we are talking about a digital vault, where a centralized patient data is going to be available. Centralized patient data will make the requirement of every time you go to a new doctor, one more test to be done. Everyone says, and I don't have the test report because we don't keep any of our reports in one place. Now, with the digital vault being available, you don't have to redo everything. Lastly, I think the other thing is going to be that will definitely help is the early prediction of what is likely to happen. That is going to be a big decision maker in terms of improvement of health for people or health management rather than disease management. I think these are going to really impact a better cost management for patients and also create a better outcome for them. I can give you an example on the cancer treatment itself. We have a AI generated, auto contouring as well as auto uh, aiming for the treating radiotherapy, which is otherwise very challenging. And when you do that in a right way, you are able to do it in less settings and less cost. And the most impactful outcome is the health of the patient. Is it getting better? I think if that is happening, if you are not losing life of a patient, that is also another positivity. So there are hundreds of ways in which this is going to improve the overall wastage reduction. I'm absolutely certain that in probably next 10 years, we will see this definitely coming down. I'm not going to say that this is going to decrease the cost of treatment. Cost of treatment will still be high, but it'll bring it to the early stages that will reduce the cost.
So they should also, like take care of the unnecessary treatments and,
Exactly.
the wastage that goes on there also, right?
Right.
Yeah.
Absolutely.
So
Absolutely.
yeah. Thank you, sir.
Thank you.
Dr. Maitri, quickly.
Yeah, I think it was a great talk. Thank you for this forum. I'm an integrative oncologist and a radiologist, and I sometimes worry about the medical legal implications this is going to bring in. We've had generative AI for now, where Dr. Google has been consulted for second opinions many times. And with the agentic AI coming in, I feel creating awareness on this is very important for patients and also for us doctors, how to use it right, to give the right prompt. And even doctors, I think, kind of need training. I've been involved in the wellness space, mostly on the US side, and it's been very expensive and available only to the elite. But I think this can make it reach the masses. My question is, how can doctors get more involved in it, share their knowledge and expertise, and make that transition or make it better for the greater good of the public?
Absolutely. You put a perfect question. I think this is where in my one of the thing I put is the training tools. Each company, there are many people who are trying to really create this because skill is going to be a huge problem. And there always used to come a question about is AI going to replace a radiologist, right? AI is not going to replace any radiologist, but AI is going to replace radiologists who are not learning AI. I think you need to learn AI. That is very, very important. And even I think look at the national level, international level, there's a lot of training happening. IIS is coming with a new educational institute within IISc campus. They are giving MTech degree to doctors. They are opening a new hospital, Partha Balaji Hospital. And in that hospital, they are also bringing in a new master's degree and PhD degree for doctors who will learn how to work on this. And this is going to be most important piece. The technology that we are working cannot be created without the doctors, without radiologists. And they need to be the ones who need to be at the forefront of learning, because if they are not, this is not going to find the light of the day. So to me, this is going to happen. This is going to happen. And FDA is still very careful in making or keeping the decision still in the hands of radiologists to say, I agree. And then AI has to agree with you, and not the other way around right now. AI is assisting you, and you will get a lot of tools and training as you go further. Yeah.
Just a small point I would like to add to Dr. Maitri Shankar is that I'm working with our group on a very interesting data set creation, which tries to prevent these LLMs from generating harm responses in different areas. One of them is healthcare, and especially in hyper local situations of disease, of this and that, because they don't have enough data. So one important way in which doctors can contribute to us, and we are trying to create these apps and things like that, is to provide us with knowledge and data, because that knowledge and data is not thoroughly available, neither in textbooks, and nor in research papers, nor in anything else. So that is number one, where AI methods need to have huge amount of data, and that I think is one side of the story. The other side of the story is the interpretability of the AI algorithms. That means when the AI makes a solution, there are two aspects. One is called interpretability, the other is called explainability. Interpretability is AI should tell us the pathway that AI took to come to its conclusion. And that pathway, because of its probabilistic reasoning to some extent, will give an idea, because you are always told this is it, but you are never told the confidence level, what were the other options, why did AI take this option, all that was not told. And I think that should be told to experts. So interpretable AI gives AI transparency. It also helps domain experts improve AI. The other is explainability. When AI tries to explain something that it did in its multi-dimensional space to the domain itself. And this explanation comes to two kinds of people. One is it comes to a medical expert. So now AI has got this billion dimension space on which it has created some patterns and it is trying to convert it to a medical language. And it is obviously going to make certain errors. The other more difficult part, and which doctors like you have faced, is how to tell a very complex scenario to a patient. So this is the other explainability part for which we really need a much better scenario coming out of AI. And that is part of the current trends of responsible AI, which is coming out. That AI should come up, should be transparent, like our saying that this is how I took my decision. And secondly, it must be able to try and explain it in the language of the domain. The third most important thing, and which is very interesting, is that, as you mentioned, now if AI makes a mistake, who is at fault? You will say, I created data from millions of places, millions of machines ran the code, so I can't go and find out who made the error. So now there is a very clear demarcation of how AI was trained, so that if there is an error in the piece of data or there is an error in the algorithmic modification, it goes to the root cause and it finds who is responsible. So these are the things that are coming up in responsible AI, and hopefully it will become a much better form in the future. I hope I've been able to explain.
Yes, sir. Thank you. Yeah, thank you.
Thank you so much. Like indeed a great discussion. Before I move to the next question, for all participants, I request to fill the feedback form. Feedback form is available and the link is posted in the YouTube channel as well as to the chat box here in this Zoom. So I request all participants and please fill the feedback form. This will allow us to deliver participation certificate also. Before we have few questions while the people registered for this event. So one of that question comes from the ethics side, and question is, how do we ensure that digital health innovations, particularly AI-based diagnosis, remains ethically sound and unbiased in their outcomes? Any of
This is a great question. I think there's a lot of work being done here. I think it requires, AI solutions that are done in US will not give you a right solution in India. You have to use the right data. No bias should be there because, are you using the data only of males to decide the disease of female? That's not going to give you that. So this is something that every AI algorithm that gets developed and deployed, I think there are laws and rules being governing this, are also ensuring that this is maintained. And on the ethics piece, in terms of how do you get the data, getting a data with the consent form. Many times we see, most of the companies who are trying to look at it ethically, they work with the hospitals and data providers who have set a very highest standards of ethics in collecting the data. It is not just one of the boxes someone ticked without knowing what box you ticked and signed, that your data is being shared for certain purposes. And that will be made very clear. And these are some things that almost majority of the companies who are considered ethical companies today uh, are doing it. And I'm also seeing, some of the startups have also started doing it because the governments are also trying to do a lot of audits on that. So, if I'm seeing it today, if we are developing algorithm on, let's say, COVID detection when we're doing it, we were doing it with data coming from multiple countries. And then the data was audited for making sure it is, one is ethical, second, bias is eliminated with right kind of data, right kind of volume of data coming from different regions and different ethnicity. So this is a mandatory requirement. Without this, AI is not going to provide you right results.
Yeah.
This I call it as a hygiene factor that needs to be met by everyone.
Partha sir, would you like to add something or shall I move to the next question?
Yeah, you want me to answer? You can move. I think he has answered it, so you can.
Okay, perfect.
I can also give a few comments if you want, but whatever is your choice.
Sure, if you can have a few comments, then we'll move to the next question.
One part of this ethic is on bias, as Dileep mentioned. One is data bias, one is algorithmic bias, and one comes to an automation when the automation system is asked to take a decision where both will cause jhamela.
Okay.
All right. So this sort of decision making where both sides will cause a problem, where human beings take a decision by consent of family, there's a whole process. But if AI is asked to take a decision, so AI, the problem with modern AI is one simple problem. It does not know what it does not know.
Right.
And because it does not know what it does not know, you go to ChatGPT, you try to ask it a question, and then it will say something. Then you say, no, you are wrong. After you force it to say, no, you are wrong, 3 times later it will say, okay, no, sorry, I am wrong. So it really does not know what it does not know. The other thing is very interesting. You have to remember that large amount of data which is used to save the life of millions of patients have been taken coercively from others without their consent. Now you have a moral dilemma on both sides. If you don't take this, then you won't have enough data to save lives of people. If you take this, then you are destroying lives of people, destroying their privacy, destroying everything else. So now which side will you take? So different countries take different sides.
Yeah, in fact, that was also a question.
Yeah.
How is that data, all data are protected? I think that was very nicely.
I'll give you a simple example. You go to Europe, here you go to, in India, you open any newspaper and any mobile news, and you look at the news, it will show you the news. You go to Europe, the same link you click, it will ask you 30 questions. Are you giving consent? Are you doing this, etc. to read that same thing?
Yeah. I think there's a wonderfully explained, so nice. Extension to that, our next question is basically, can we have a health code created for each individual, like Aadhaar number? Can we have some health code for each individually? Is the feasible, or is this the option government or society is thinking about that? Or as a researcher, you people are thinking, or industry, you are thinking moving towards that direction? So that is one of the questions from our participants.
This is part of digital health mission. You will get a health code, but it comes with very interesting thing. There is something called de-anonymization, because this code, if it starts getting accessed by lots of people, unless that code that code should only give you access to your health information and only those who need it and want to use it. But now AI is so complex that if you say that here is this rare disease, and based on this rare disease, this code number has it, and you track all over the country from some other social media data, you will go and catch the person there. I give you guarantee. So AI is very, very complicated. It's a two-edged sword. We always have to remember AI is a double-edged sword. So in order to use the double-edged sword, we have to be careful about what to do.
So how do you draw the balance if it's double-edged?
No, so that is where comes regulation, governance, technology, and everything else, and how to handle it. But along with all this governance, regulation, technology, if you want to use the power of AI, then you will need all this. And like viruses everywhere, hackers will be there to crack you. So you will live with it. Take it from me. You will live with it. You can go on strengthening. You can lock your house 20 places. You can lock your house. So you can reduce the effort. And that is what should be done.
Right. So our, in fact, a couple of questions are very much related, like this is for Partha sir. What all the area of research, hot topics of the research happening in the academia? And for Dileep sir, what are some of the success stories from industry side you would like to share?
Well, I think there are many success stories from industry side. I think if we keep listing, I think the list is enormous. We talked about robotic surgery today, right? Robotic surgery, which is being done remotely. In fact, in India, the first remote robotic surgery where a person surgery was conducted with doctors sitting somewhere outside the country, and that entire surgery was conducted in India, was done. This is a great success in terms of remotely managing robotic surgery. I talked about earlier on AI, the use of AI, especially for ultra portable X-rays with TB, and now multiple diseases. This can be used for even lung nodules and other things to be done. The other AI use I'm telling you is the MR. They call it as deep resolve in actually generating images in MR, which will start giving you insights also while it is generating images. Done at 1/10 of time is because of AI. It learns quickly. The AI detection, AI using AI to detect COVID, one of the biggest impact that was created. And I was also during the time of COVID, I was a part of GE Healthcare. At that time, I think within 3 months, the entire team of GE Healthcare as well as Microsoft together, we created a patient monitoring system for remotely monitoring multiple patients with the facial expressions and taking the data that is coming from the monitors and everything so that people sitting remotely can monitor patients. I mean, if I start listing, probably there are thousands of AI applications, starting from workflow optimization for managing a patient flow in a hospital to make patient experience better, to a clinical outcome, which is a lot more impactful, to improving the billing cycle, and you name it, and you have AI coming in everywhere. So there's huge opportunity to still, not everyone is using everything, but it's a very exciting time. The inflection point, I call it as a change that has come in last few years post-COVID, is, I think, a different new technology inflection. Yeah.
Thank you, sir. So let me list you the future and the research.
Yes, sir.
I'll take you through 3-4 examples. When there was COVID, then my student was at home. So I asked him, what were you doing? So he says, I had nothing to do. So I was helping my mother make rotis. So I said, you made rotis? Did you ever make it before? He said, no, I'm a pampered child. This was the first time I made. So I asked him, how many, did you get the roti right in the first shot? He said, no. I said, how many trials you need to get the roti right? He said, I required 4 trials. So I asked him, he was my AI student. So I asked him, how many trials would AI need? He said 1 million trials. So there is a huge difference between how human beings learn with very low amount of data. And so that is number one problem that we have to solve. Very low amount of data, very low amount of energy. So that is very, very important. And that is a fundamental problem which we have not been able to crack. Today, all our AI requires nuclear power plants. The second thing is, today AI will be in my spectacles. So I will be able to see JE question paper and the answer and answer it. Tomorrow, it will be a chip in my brain. And it will tell my brain to tell my hand how to write. So now I won't know who is answering. And I will live with it without knowing who is taking the decision. So I will start forgetting that today you know the difference between me and technology, computer, AI. Day after tomorrow, you will not know the difference of you. Which part of you is the original you and which part of you is the instrumented you, and who is acting, who am I, this whole question, we will get into deep, deep trouble. The deeper trouble will come when all this information science will no longer require electronics, Dileep ji will tell you, will carry through the biological life cells. So now instead of having electronics embedded in you, you will have some more molecules, etc. embedded in you, which is taking decision. Now neither you nor anybody else will be able to make out who is taking the decision, who is the human being, who is the machine, who is what.
Right. Oh, very nicely said, sir. So, just to add to that, sir, it's from my side, question from my side. You mentioned that now we are introducing MTech for doctors. Is there academia has any plan, MS or MD for engineers?
Yes, sir. See, for last 12 years, 15 years in IIT Kharagpur, we run a program called Masters in Medical Science and Technology, where a medical doctor, MBBS doctor, comes and learns technology. Unfortunately, 95% of them are taken go abroad. Or many of them go to these healthcare companies and organizations. We are now having a program where a doctor and an engineer will be coupled together to solve a problem and will get a degree together. So the time has come that we couple them together into studying together, and then they start fusing themselves. And therefore, the time when a medical school is in a technological institution is not far away. The only problem now is some regulation and policy, that whether we are allowed to give MBBS degree or not. But if we are allowed, then an MBBS, MD, MTech, BTech, MBBS, all this will be straightforward. It will come in 5 years.
Okay, wonderful, sir. We are looking forward for that. So, sir, in fact, you mentioned about putting chip in our brain or something like that. I think that's our. I can see one raised hand. Sir, I'll come to sir in 1 minute. I'll come to you, sir. One question related to that is that not we are becoming over dependent on technology and we are losing human touch? And from like sometimes we call it like mother's touch, take away half of the problem. So are you not becoming over dependent on technology and losing the human touch?
Dileep ji will be able to answer better, but let me tell you, leave aside mother. Leave aside mother, half the other human beings don't treat human beings as human beings, all right?
Okay.
Yeah. So let us be very careful. Mothers ko chhod dijiye. Mother is a different breed altogether, all right? Yeah. Mothers are a different breed altogether. They are psychologically, biologically, every logically different breed. But there are student will ask 200 questions, teacher will get irritated. ChatGPT will never get irritated.
Mm.
Day after tomorrow, chat caregivers who Dileep will correct me or not, who will test your dementia, answer your questions. You have half dementia patients in the home, they are all isolated. So the human touch is not in many humans itself, sir. But that human touch, which is in real human beings, is not in machines.
Mm.
Prashant
Prashant please raise the hand.
Yeah, namaste everyone. Sorry to request for early this thing chance because I need to rush after this. Okay, my name is Prashant. I'm from Sagar. Okay, I'm a co-founder of a startup called Sagar Medical Devices. We are a medtech company. We are developing quite interesting product. One is called non-invasive glucometer, and the second one is called CCD, cancer cells detection. So there has been a lot of discussion going on about cancer. Why cancer is not curable is because we're not able to identify at the stage 1 or stage 0. So with the help of Dr. Chiranjeevi, who is from IIT Kanpur, we are quite successful in our R&D, and we are very close to the product development. It uses the blood sample in the recent publications from various universities like Stanford and all. An alternate to biopsy, blood can be used to detect the cancer. We have indigenously developed the electrochemistry based sensor. I'm quite confident that that will fly. Maybe I'll need Tejaswini madam's help to do sample testing in Shankara. And I've been talking to
Prashant, can you come to the question because of the time constraint all of us have?
Yeah, sure. My question is, okay, so as we said, every technology innovations has plus and minus. Okay, the cons of this AI is, with my own experience, I'll tell you, a lot of people have introduced, wellness device for especially, blood glucose testing. But what is happening is, they are using the algorithms or, the AI modeling, and they are just introducing the product without, there is not much of regulations, and it is become very easy for them to just sell few thousands of units and vanish. And it is you must have paid around 5,000 or 8,000 rupees. It is too small thing for you to go for legal. So that's why, as we discussed, I think there is a need for regulations, especially for using AI for the wellness. Otherwise, see, if somebody is making a big product for a clinical treatment and all, it's fine.
Sir, yeah, exact question to a speaker, sir. Is there any specific question you have, sir?
Yeah, there is a need for everybody to push, who can do this, regulations request.
Yeah, absolutely.
Along with this, Sujit, my suggestion is if you can read out all the questions, all the remaining 2 or 3 are there, I suppose, so that our experts can take them together.
Yeah, so I think most of the questions are answered. And now I think time is also like we are already 40 minutes delayed. So with if it is okay, then we can wind up the session. Before we wind up
with this, one more has come to me because I'm unable to enter. It seems to what level in terms of percent.
Madam, just one second. I request everybody to again fill the feedback form. That is a must. So I request all participants to please fill their feedback form. Yeah, Tejaswini madam, over to you.
No, I think even this has been answered. What level in terms of percentage that the AI can be trusted in this medical industry as we are playing with lives of people? I think this is also covered.
Covered. So I think if there could be questions which are not covered, I request everybody to put these questions. We will be through email. We will be contacting our speakers, and they will be they will be able to answer those questions. In the interest of time, I think with the interest, yeah.
We'll take Prashant's this thing. No, we will take up that. Who will be able to take? That's another important thing which he raised.
Sorry, ma'am.
Who will be, Professor, whether you will be able to take this question, Prashant?
Which question? Or
the last one, Mr. Prashant was asked.
I think this whole of regulation, testing, and all these technologies, like every drug goes through a trial process, every such technology must go through a regulation process. And that regulation process can be defined. Otherwise, we'll have tarot card readers predicting, saying that I'm using AI. So regulation as part of policy for any such technology that is getting through, we must look at it more carefully.
Thank you. Yes, Sujit, please, we will.
Yeah, sure. Thank you. Thank you once again. Before I formally invite Meena Shastriji to deliver the vote of thanks, I request both speaker just few words about what are the future things in this device part we as a common person should be looking forward from the industry perspective, from the academia perspective. With that, probably we will go to the formal vote of thanks.
Dileep ji.
Well, I think I will say one of the things that a lot of medical industry will start moving towards is the devices, the wearable devices will start becoming your health monitoring. You have already seen your watch, Apple Watch has become almost as good a health read for, measuring your heartbeats, doing a ECG and all. These are the technologies which will start evolving, whether the health rings or wearable devices which will start monitoring continuously. These will be at the first level for screening your own health, especially for elderly, fall detection. I'm also a part of IIT Delhi's innovation hub, where we look at a lot of startups who are building a lot of technologies to help elderly. I think there's a huge amount of focus for geriatric population for health monitoring. You will start seeing a lot of devices, especially in your homes. You will probably in the future see the equipment in terms of light bulbs and other things will act as a health monitoring for people who are living alone, elderly people living alone. Those will start acting as like movements, the expressions, and many more things, which will start using that as a feedback to monitoring solutions. So wearables and monitoring of health will be the key thing. At an advanced level in terms of a detection, monitoring, curing, diagnostic level, those will continue, which is at the industry level, where you will not see the direct impact because you will see only the result. But on a personal side, you will see these things which will act hugely impactful innovations in the coming years.
Sir, just to give an answer to what you said, AI has got four functions. One, it provides descriptive information. Second, it provides predictive information. Third, it provides preventive information. Fourth, it provides prescriptive information. We have to treat all of them differently. When it gives you descriptive information, it should become explainable why it is describing, it should give you alternatives, etc., everything else. When it is giving you predictive information, it should not just say one thing will happen. It should give you various possible pathways of what can happen. Nothing can go directly only in one direction. So it should give you the scenarios. When it comes to preventive, it must make sure that it does not allow you to do something which is unsafe. So it makes you preventive in the conservative side. And when it is prescriptive, then it should ensure that it will take opinion of 3 others AI systems which are independently developed. Like you go for second opinion, third opinion, fourth opinion, and they should converge to a conclusion. So for each of these cases, the way the AI you should believe on the AI is different. So When it comes to prescriptive, then it's one level of safety is different from when it is descriptive. I hope I've been able to.
Oh, yes, sir. Absolutely. Absolutely. Thank you so much. In fact, it's all, I'm sure this with AI, our futures are certainly bright. I'm sure society will be much healthier, much, prosperous, and all. Much healthy society will bring lots of positivity in the society coming days. So I'm sure these AI or devices will play a major role. So indeed, both of you have highlighted these things very, very nicely. With this, shall we invite, Meena Shastriji to formally deliver the vote of thanks.
Okay. Thank you so much, everyone. Yeah, a very live topic. And while the whole world is talking about AI, learning about this in a forum like this is very interesting, especially when we talk about health, which is very close to our heart. Now, manage the health, not the disease. That was a very thought-provoking statement. I think it will be something that we will talk about in the days to come. Now, I would really like to thank our esteemed speakers, Professor Partha Pratim Chakraborty. Thank you, sir, for taking your valuable time, and thank you for your valuable inputs. A token of thanks from AKP to you, sir. Ma'am, can we have the token of appreciation on the screen? Okay. Yeah, that's a virtual one. That's nice.
Wow, lovely. Thank you so much.
So,
we will arrange it to send across. Yeah, we will we'll organize the physically send it, not just show here.
Sri Dileep Mangsuli, sir, thank you so much for your valuable inputs and time. Again, a token of appreciation from AKP to you also, sir. Ma'am, can we have that on screen, please?
Thank you.
Thank you so much, speakers, and thank you to our chairman, Anand Kumar Pratishana, Professor Shri Krishna Bhaji, our trustee, Dr. Tejaswini Anand Kumar, and our trustee, Dr. B.S. Srinath, our NFD working team, Shri Sujit Kumar, Hanumant Managoli, Purna Pragnan, Shri Pradeep Oksar, all the staff and volunteers of AKP and Adame Chetana. I would also like to extend my heartfelt thanks to this August audience, indeed the August month audience, who have taken time out to be a part of this educational session. We have many dignitaries. Sorry, the list is too long for me to announce, but thank you so much, dear dignitaries, for taking time out and being a part of this session. You've been very supportive with all our initiatives in various ways from time to time. Before we draw curtains for this 14th edition of NFD, thanks to Anand Kumar Pratishana and Adame Chetana for coming up with excellent and apt topics from time to time through these Nation First dialogues. Till we meet again for our next series of this initiative, this is Meena Shastri signing off. Thank you all and have a great evening ahead.
Thank you.
Thank you.
Thank you. Namaste.
Thank
Namaskar.
you. Thank you all.
Namaste.
Thank you all.
Thank you, guys. Thanks.
Thank you.
Yeah, I think now we can conclude, I guess. We can close.
Yeah. Thank you. Thank you, Professor, and thank you, Dileep ji.
Thank you. Thank you so much, madam.
Thank you,
Thank you,
ma'am.
Pradeep ji.
Yeah, thank you.
Thank you, everyone.
Yeah,
Thank you. Thank you.
Purna, I think we can close the things. Thank you so much.
Yes,
Bye.
sir. I have stopped the live streaming.